we're going to go ahead and get started. As you can see, I shared our poll results. You can see that we have the majority of everyone on is a mom or has one child. So whether you have children, currently pregnant, or planning your pregnancy, or even a grandparent, we're very excited to have you here with us tonight. My name is Tony, and I am the marketing director for Strong Beautiful Future. And Strong Beautiful Future is a digital community with the goal to ensure that Black moms have a healthy pregnancy and that they have safe births in spite of the health statistics that we all are so very aware of. Tonight's conversation is about what happens when you found out when you're pregnant, and we'll be sharing advice on how to maintain a healthy pregnancy. So there's a couple of ways that you can get involved tonight in tonight's conversation. The first way is if you have a question for one of our healthcare providers on our panel, please place your question in the Q&A box. This will help us ensure that we are able to get to your question that you might have about pregnancy or motherhood. If you have any comments though, or would like to share a personal story, we want to hear those too. Or you just have a general question, you can put those in the chat box. And we have a team member that is monitoring that channel to answer any general questions there and to ensure that you have everything that you need right there. So if you have any questions, if you have questions for our panelists, Q&A box, just general questions about the campaign or anything else, drop those in the chat. So a little bit of an overview about how tonight will go. This evening, we'll be speaking with our Strong Beautiful Future healthcare providers, and we'll be starting the meetup by answering questions about preconception, pregnancy symptoms, birth planning, and low birth weight prevention. Then we want to hear from you. The second half of tonight is dedicated to answering all the questions that you might have. And again, you can place those questions in the Q&A box. So a little bit of housekeeping to round this out. I do want to give a disclaimer. We understand that especially in this time of the pandemic, there might be limited opportunities to speak with providers like this in this intimate setting. However, I want you to know that this information provided here tonight is not personalized medical advice. It should be used as a way to start a conversation with your own healthcare provider or physician, and is not to be used as a substitute for healthcare visits with your primary care provider. All right. Before we get started, I'd like to give a special thanks to tonight's sponsors, Healthy West Orange. Strong Beautiful Future is made possible by the support of the West Orange Health District, proud founding champions of our local Healthy West Orange that you'll hear more about at the end of the program. So with that being said, let's get the night started. So I want to start by introducing our providers who work with us on a regular basis. First, we have Dr. LaReesa. Dr. LaReesa is a women's hormone expert, integrative health coach, and consultant with nearly 2 decades of experience in women's health as a board-certified OB-GYN physician. Next, we have Dr. Candice Jones. Dr. Jones is a board-certified physician practicing as a general pediatrician in Orlando, and she provides a standard of care that enriches the lives of thousands of kids and parents each year. And last but not least, we have our midwife, Brenda Francis, who is a medical midwife who provides direct assistance and monitoring for women and their babies during childbirth. She has more than 25 years of medical experience, including nursing, birth work, education, and advocacy. Her goal is to bring awareness and solutions to the alarming maternal and infant mortality rates among women of color. All right, so I'm gonna ask all of our providers, yes, you beat me to it. Welcome, it's nice to see all of your beautiful faces here. All of our panelists are a part of our Strong, Beautiful Future family, and you can see their videos on our website, on our social media channels. So thank you all for joining us so much tonight. Let's jump right into the conversation. I'm really excited about this because I have not had children yet. And it is one of those things that is on my list of things to do when I can find time or space. I hear that it's never the right time. But I wanted to actually ask the first question to Dr. Ferdinand. So what are the best ways to prepare your family, your mind, and your body for pregnancy? And I would love to, again, never been pregnant. I would love to hear any personal stories there as well.
Hi there. Thanks for allowing me to join in. Hi, moms. I think this is always a good question to start off with because almost 70% of pregnancies are unplanned. And when you have that opportunity to actually plan for something so big as bringing a child into this world, it really does make a big difference from a maternal standpoint and an infant standpoint. And I like to sum this all into, one word. Do a really good self-inventory. What I find, especially the bulk of this campaign, has to do with understanding there is a need in a certain population because of some of the particular odds that are there with increased maternal and infant complications or low birth weight for infants, or moms have an increased risk of having maternal complications like high blood pressure, heart disease, and obesity, and many other things that go along with it, including diabetes. And so when the self-inventory occurs, it's really looking at, okay, how is my state of health now? And what are my plans for when I do have a baby? And that's everything in your environment, your physical environment, your health environment, your financial environment, because what is so important that is not discussed as much in mainstream media is that we're finding more the social determinants and stressors end up impacting African-American moms so much that are leaning more into these odds of potentially poor outcomes, or 3 to 4 times the complications or maternal infant complications than our white counterparts. So, and that is whether access or different types of housing or financial needs or just institutional racism over time. These are considered social determinants. So I think that self-inventory of, okay, where I am with my health, where am I with my environment? In the freebie that I have for moms tonight, I talk about detox, detox from your diet, detox from basically the people that don't serve you, because all of these stressors compact the ultimate outcome of your baby. We do well as OBs, and if you have the right OB, we know how to manage when you get there. It's the preconception we need to really tap into to really see that needle, in my opinion, change and really get the impact and the outcomes long-term for our moms and our babies.
Brenda, just that mention of social determinants of health, and it can be environmental, it can be all a myriad of things. And I'm reminded of everything that happened over the summer, right? And as early as a few weeks ago, quite frankly, what does that stress and that trauma, like, how does that all play into what Dr. LaReesa was talking about?
Well, it's awesome. She brought up a lot of really valid points and things that we like to share with our families that are expecting to grow, their family size. Detox was a biggie. Watching, like with the current, like you said, the current condition of our environment, making sure you're using all your PPE, staying, just protecting yourself from all those environmental stressors and toxins and, just trying to stay healthy. Diet is a biggie, making sure you're boosting your immune system, staying away from things that can cause your immune system to be compromised, as well as removing the toxins from your environment. Smoking is a biggie. Drinking, any other things that could hinder the potential environment for you to grow a healthy baby. So it's real detoxing, as well as making sure your environment is cohesive for a healthy foundation. Because we know that when we're pregnant, we're building a human being, right? So in order to build a healthy human being, we have to have a good foundation.
Absolutely. Dr. Candice, you came back just in time, because I wanted to ask you, it's interesting, Dr. LaReesa sees the baby when it's still inside a woman, but you see the outcome of preconception and those 9 months. What's some advice that you have in terms of how to prepare?
Yes, I would echo many of the things that these ladies have said. But that first point that Dr. Ferdinand said about, the overwhelming majority of pregnancies are unplanned. If we could, because I try to be solutions oriented, if we could make a dent in that number to help our community to understand that pregnancies can be planned. They just don't have to be, I'm pregnant. Now what? And then we have to react and respond. If we could just plan it out. So if we could catch young girls before their debut of sexual activity and make sure they're on long-acting contraceptions, right? Potentially. Or according to what you believe, if we're comfortable that they are going to wait and be abstinent. And use other means of protection, but that we really dig in there. So that requires us to talk to our children about sex and boys and all of these things. So I just want to throw out there, and even as adults, we sometimes have uh-ohs, right? Mm-hmm. And so we really, really need to think this thing through. As Dr. LaReesa said, what is your inventory? Are you financially, mentally, physically, emotionally capable at this time to have a baby? If your answer is yes, do you? If your answer is no, then take a pause, have some form of prevention, because you don't need to bring a baby into the world at this time. So I think we need to work harder in that area to try to prevent some of that. But for individuals who find themselves pregnant at this time and they may not have what they need and you're already here, then where do we go from there? And so I'm reminded of my residency. I was married. We delayed. We're going to try to get pregnant the third year, the last 6 months, so I can get through this. I mean, I'm a planner. I can get through this I can get through the pregnancy, but still have 3 more months left before we have the baby, but I'll be done. Look, I thought I had planned it all out. And as you said, there's never a right time, because I ended up on bed rest for a whole month in residency. And so even when you plan, things can go wrong. But I'll tell you what I had. I had support. I had insurance. I had income. And so we really need to make sure our ducks are in a row before we bring children into the mix, because they depend upon us so much and they're so vulnerable. And what's going on with us not only affects the child that comes out, but it affects the child that's growing inside, because I liken that to growing a plant. If it doesn't have the right soil, the right nutrients, the right pH, the right amount of water, if it doesn't have the things it needs, it doesn't reach its full potential. So those are my pieces of advice. When we're doing what we're doing, think about what soil are we setting up our children to grow in and try to thrive and flourish in.
I love that. I absolutely love that. So, Dr. LaReesa, when a woman is in that preconception phase, she's thinking about it. Maybe she's taking some, birth control. Maybe she's not. What are some questions that woman should be asking as she's sort of approaching that phase in her life? Like, what are those conversations that you would love to be having with your patient?
Yeah, absolutely. So ditto on everything as far as, I'll bring the things as far as self-inventory. But one is, I really like to get a good history of their current health status, because there are so many like little things, from a baby aspirin to starting on a different type of medication that could totally change the course of a woman's pregnancy. So let me paint, kind of that picture. Some top questions that I'm always going to ask has to do with your menstrual history. Have you had fibroids before? Because they're more prevalent within our African American and our Hispanic females. And it's the most common trauma that a woman can have in her lifetime. I'm going to ask, are you on birth control? Because one of my jokes has always been, we take a prenatal, but majority of women don't start it until after they're pregnant. And the ideal time is to start it at least 3 months prior to pregnancy. And especially, we miss the boat a little bit with educating our patients, because if you are transitioning off of a contraception, pills or methods may have depleted your minerals and your vitamins, and on top of a poor diet, all of a sudden we don't have a good environment, that soil that Dr. Candice was talking about, for implantation, for support of the pregnancy. And this is not only for mom, but this is also important for the development of the baby neurologically, overall the growth. And putting on top of that, some of the things that that are depleted are possible, like vitamin D, which we always talk about now, complex B vitamins, folate, and one that we don't talk about enough, which is choline or DHA. And it gives you an opportunity to say, hey, this is what we need to do. Or a mom who has had, my other component, previous miscarriages, or something that happened where she had a preterm birth, which is the number one issue with most of the complications that lead to low birth weight, which are higher in African American women. And so we try to tackle those things. So history matters, and being very blunt about your history, from your menstrual history, which there's certain tunes that I can always catch about that. If you've had more of a hormonal imbalance throughout your whole menstrual history, and many of the other things that I've already mentioned, but that you can tune in so much and change the course of the journey of a mom's pregnancy just with pre-planning and the preconception period.
What I'm hearing is like there needs to be a lot of intentionality. Like even, it wasn't until like recently, embarrassingly recently, like I could really consistently track my menstrual cycle. Because I know whenever I go to the doctor, they're going to ask me that, and I was tired of like not knowing the answer. So once a woman finds out that they're pregnant, Brenda, what should be the next step? Oh, you're on mute.
Sorry. Locating a provider that fits their journey. So there's a plethora of providers that they can glean from, obstetricians, midwives, doulas, childbirth educators, lactation consultants. So building that team for her birth journey, that journey of birth that she's about to embark upon, putting all her ducks in a row, finding a provider that's going to be suitable for her journey. So if it's a mom that's looking for a natural birth experience, seek out providers that mirror that. Or and with that being said, there's multiple different providers, the OB, there's nurse midwives, there's licensed midwives, there's a plethora of providers out there and available. So do your homework, do your research, and find that provider that's right for you.
And Dr. LaReesa, back to you, because I've read some research lately or recently about, Black women having better outcomes when they have a OB-GYN or a doula or a midwife that looks like them, and sort of the implications around that. But I think that there's like this, I would say, myth that there aren't a lot of us out there practicing medicine. So can you talk a little bit about that? Just like, I'd love to just hear about your network of colleagues who are Black and out there and want to help.
It's interesting because we're all, at some extent, the panelists, we're part of our own personal network or group. And so there we feel like one of many. But when we actually work in our environment, we're one of, blink your eye and I'm about it, and we formed those relationships. And that's one good thing with social media and networking through all those things, because you are able to find each other. I just left a hospital where not only was I the only female OB-GYN, I was of course, the only Black female OB-GYN. And that was one of the reasons why, I enjoy being in the area, so women can see someone that looks like me. So, and it's interesting because I've dealt with the relationships with UCF College of Medicine or teaching medical students or residency, that number hasn't really significantly changed with Black medical students matriculating through. So that number tends to be still kind of wavering low. And so depending on where you're located and what hospital you work at, you may not see us. And then on top of that, the hospital delivery setting has changed. And I'm glad a midwife doula is here because they can share their experience, because our experience may look like, okay, your primary doctor may follow you, but they may not deliver you. It might be, and that's a big question to ask when extrapolating from what Brenda has said, because you might want to only deliver with your physician, and that might not happen. And that might be something important, a very important question to ask. So I get it, ladies, you want somebody that can relate, you feel like you can relate to. And it's interesting because historically in older Black communities before, you always had a Black midwife who was part of that community. Mm-hmm. And so they followed them to the appointments with the white male doctor. It made them feel comfortable, so it's interesting how even though those outcomes might have still been more maternal and infant death because of access or social determinants at the time, that security and that community was always around that woman who was pregnant, and you had different service programs that made sure a Black midwife was there with them. And that doesn't exist right now.
Yeah. And I love that. I'm going to brag on Strong, Beautiful Future, because that is something that we talk about a lot, is just like, build a team, just like you have your tribe of girlfriends or family members or whatever, you should have that same sort of intention and energy and people around you on this journey as well. Dr. Candice, so obviously we talked about, finding out you're pregnant, get to a healthcare provider, and there's a lot going on in those first few weeks. There's morning sickness, later on, the baby kicking. And what I'm going to categorize them as symptoms, but what do those symptoms indicate about the health of the baby and the health of mom? And what are things that women should be looking for? What are flags that something might not be okay and that they need to check in with their provider?
Yes, certainly. This question is probably more in the purview of our obstetric team, but I'll take a stab at it. So, and I've had 2 kids, and I learned a little bit of this stuff. But anyway, what I've always learned is, especially the morning sickness is probably the most common thing. My doctor always told me, my OB-GYN always told me, that means everything's working well. That means your baby's growing well. That means the hormones are just right, that your pregnancy is doing what it's supposed to do. So even though you feel miserable, and even though it's not fun, that's a part of the process. It really is. Now, certainly it can go too far. There's conditions where you have hyperemesis. That's a problem where you get dehydrated or you don't have enough nutrients. That's not healthy. So you do need to check in with your doctor if you feel like it is extreme, and ask them, and they'll ask you the necessary questions to find out if it's gone too far. Other things, I just know some of the ailments I had is more from growth and structure and things spreading out. So you don't have so much space in your torso or the midsection of your body. So as that baby's growing and the uterus is growing, you may have reflux, you may have aches and pains. And all of that is a process, because your uterus is expanding and growing and a baby's growing inside. So your body's majorly changing. And so what I would say is, ask your doctor to be proactive, and ask your doctor for all that, what we call anticipatory guidance. Get information sheets from them. A lot of them are great about giving you, these are things to expect. This is what you can do. And if this happens, call me. So you want that. And then you also want to ask them for credible resources. Okay. Instead of being on Facebook and on social media and Dr. Google, find some credible resources that they say you can, that you should look at to learn, because knowledge is power. The more you know, the more comfortable you are, and the less anxious and worried you will become when things happen. You already know, oh, she told me that. Oh, I read about this. That's what this is. And then you'll know what to look out for if it's a red flag. So that's my advice with pregnancy and with almost everything.
Dr. LaReesa and Brenda, do you have anything to add?
And this has to do with birth planning, right? I think Brenda had brought up a good point that was also very aligned with what Dr. Candice discussed, is really a birth plan is not just delivery. It is so many other things that kind of go along with that. I mean, there's 40 weeks in a pregnancy, and morning sickness is very common. Pain is very common. In preparation, I was following some things in the chat. So I was very happy to see that, some people, regardless of unplanned, it didn't matter. It became a beautiful experience for them. Their husbands and their family stepped up. But, honestly, I'm going to put a good majority of those comments in the minority of what I see, and this is me being, relative to what I may come across, because oftentimes it might not have happened in the prenatal time, but it ended up happening in a postpartum time. And now even my American College of Obstetricians and Gynecologists, they're trying to formulate better plans, because the postpartum is not just 6 weeks or 8 weeks based on your short-term disability or when your employer said you can come back to work. It's technically a year, and we're the only industrialized country that doesn't recognize maternal postpartum care or away from work. A lot of industrialized countries, oh, you're pregnant, oh, we'll see you next year. So understand that these are times of birth planning where it is great if you can do pre as much as possible. If you have that support system, great. If you have a beautiful pregnancy, great. But the biggest wow ends up coming planning for postpartum. What does that look like for you? And I think oftentimes that's a mixed opportunity that can definitely be part of the preconception birth plan.
And as part, Brenda, I wanted to get your take on birth planning and also wrapping in their birth spacing. So that idea that it's postpartum is really a year. Can you talk a little bit about the importance of, again, maybe it's getting back on that birth control.
Yeah.
And, so there's not any oops happening.
So the planning phase, like the doctor was just saying, how significant it is to actually do your planning. It's not just the pregnancy, but it's the birth experience itself as well as postpartum. And so a lot of times we encourage moms to do things like put a birth plan together. I like to encourage moms not only to put a birth plan together, but put a plan of action in effect. Like if you're planning a home birth, pack that hospital bag just in case, pack a bag for the baby just in case. We don't know, because we may have a plan, but ultimately healthy mom and healthy baby is what we're looking for, right? Then also, when you're doing that planning, you need a team. If you already have children, who's going to help out with those children once the baby comes? How are you going to get adequate rest so that you can recover effectively, right? So getting a team in is all about, we got to get back to that village mentality, like you said, gather together your team, put a plan in place, and then activate it. So yes, we want to see moms planning, like getting your bags packed, regardless of what your plan of action for your birth space. Still have a bag packed, right?
And given that we're in a new time, pandemic times, it's even more important, maybe.
Exactly.
I would say, to do that.
Yes.
So I would love, or any one of you, to talk a little bit about the implications of COVID and keeping those doctor's appointments and all of safety and all that.
Staying safe. Yeah.
It's a new world out here.
It is. And so that ties in as well as getting your plan of action, because you can plan for your auntie or the girl down the street or whatever to help you out. What if she comes down with COVID before you give birth, or when you're in the midst of it all? So keeping those things in the forefront of your mind, just knowing, getting some affirmations together, getting your phone log list of, who you need to contact in the event that you can't get one person or the other. And making sure that you got meals ready if you have other children. And if you don't have other children, you still got to eat. You got to stay well hydrated. You got to have your nutrition up to par. So getting a team of maybe a meal tree, women from the church or from whatever your circle or sphere of influence is, they can help out with meals. Someone to come help you get the house clean, because those first couple of weeks it's crucial that you not do too much.
Dr. Candice and Dr. LaReesa, anything to add about COVID specifically and sort of what you're seeing, and what should women be thinking about?
So two things that I can think of is, one, early in the pandemic, especially when we were on lockdown, stay at home period, we saw a huge dip in the pediatric world, huge dip in patients coming in to continue their health visits, the yearly physicals or asthma follow-ups, the things that they still needed to keep up with out of fear. And that's understandable. I'm not going to the hospital or to the clinic or to the urgent care or ER because I'm going to get COVID. But what I just want to make everyone comfortable to know that all of healthcare is doing an excellent job as much as we possibly can to keep you safe. Full protocols and making sure that we have all the right PPE and also the things that you will need when you come in to be safe. So please look at your health visits, your checkups, everything as essential. Even when you have your baby, that those visits are essential. So don't stay home and believe the myth of you can, go get it at the hospital. Of course, anything's possible, but not likely. We're doing it right to keep you safe. The second thing is, I think, COVID has put a tremendous mental health strain on everyone. And so then you couple that with pregnancy, all the changes you're going through, then having a new baby, which is in and of itself stressful. I don't know about anybody else. I know people says everything was glorious and the angels were singing, but for me, it was tough. And so I was happy for my baby. I planned for my baby and love my baby, but it is a tough time. And you have your child, they can't sleep well initially. So you're constantly, if you breastfeed and they're crying, you're sleep deprived, your hormones are changing. All of these changes on top of COVID can set you up for some serious mental health concerns. Even without COVID, we have to be aware of postpartum blues and depression, and we have to know what to look out for. Our partners and our family members need to know about it. And as soon as we feel like something's off, we need to ask for help. And so as a pediatrician, I ask moms and screen moms. I know the OB-GYNs and our midwives do that on follow-up, but there's some time in there that haven't seen you. So please reach out and ask for help if you're struggling, because it's just a lot on everybody right now.
I wish you could just shout that from the rooftop. Just ask for help. It's okay. You don't have to be Superwoman and do it all.
That's right.
So I know.
Oh, sorry.
No,
yeah, I just wanted to add to, for moms, the logistics of whether you test positive, where you're not, and also what changes per hospital. And things are often changing depending on the hospital staff and administration and resources and everything. And that is steady changing. So for example, if you're pregnant right now or just, planning to get pregnant, one of the things in this COVID era to ask, anytime during your pregnancy, because it's 40 weeks, what is the current policy? Because currently at the hospital I work with, there's still only one visitor, and that's the only one that can be there. So she's correct in saying, and all, the people you thought will be holding your legs back, not there. Excuse me. The other thing too, if it's a COVID positive mom, currently our policy is if you do, whoever that one person is, they're not allowed to leave the hospital at all. So think about it. If you have children at home that need to make it to, virtual learning or school, if you have a situation where you don't have anybody that you can reach out to, you don't have meals planned, all that kind of, just understand it is navigating just based on what that current hospital plan. So ask, and even if you just want to, hey, let me go ahead and get a rapid COVID test. So I know 48 hours before then I'm not going to come up positive, because most of the time, even if you're in false labor, you may not get a COVID test until you're actually admitted. So it's not an automatic. So logistics of where you're planning to deliver are very important, because it could change. It's like literally in the past week, we've had 2 asymptomatic moms did not know they were COVID positive until we did their screen. They're in labor and telling the family, do you have everything? Is there something you need to go get? Because you're here, and they have to get screened. So imagine the trajectory that puts somebody on. They're already anxious and having a new baby. So those are very pertinent questions to ask. What are the policies and guidelines for delivery currently, especially if you're about to deliver very soon?
And I would also add on to that, know the extension of that, the policies around the baby. It used to be very strict. In the beginning, we were all scared, even the doctors, and that you couldn't be with your baby until they knew what was going on. Now that is it's more your choice. They try to facilitate, but there still are some rules and guidelines. And then to make sure to follow your baby out to retest and make sure they're okay. Because although we are saying that children are pretty safe with COVID, children under 1 are at high risk for COVID. So we really have to be careful also in the way we move before, during, and after pregnancy so we can prevent this stuff from happening.
So continue wearing masks, wash hands, social distance.
There you go.
Follow the guidelines.
Going to birthday parties, and I know we all have COVID fatigue, but you can't hang out with cousin and them and auntie and uncle and go to everybody's funeral and wedding, and then you're like, how I get COVID?
You literally just
Pregnant.
retold the story that happened in my family. I was like, well, you went to the funeral.
Sorry.
So we know that Black women face a lot of challenges. I talked about this a little earlier, but one thing that we can pay close attention to, which is a really great indicator of what a baby's health is going to be, is birth weight. So Dr. LaReesa, I would love for you to talk a little bit about like why is birth weight important and what is low birth weight? Did you hear my question?
Not really.
Okay.
But at the same time, I heard low birth weight. So I'm thinking it's that one.
Talk about that.
Okay.
Yes.
So I would definitely take it from the maternal perspective. And low birth weight is essentially less, or our technical cutoff is less than 5 pounds, 8 ounces, or 2,500 grams. And women, especially, I'll make this very specific in Florida and in Orange County. You at any point can look, March of Dimes. I really love following their statistics. I mean, they're really good. And we are still higher than the national average when it comes to low birth weight infants, especially in African-American women. And a lot of that is attributed to increased risk of preterm birth. And there are many other risk factors that are related to it, but preterm birth is actually the highest burden, not only for the family, but when it comes to obstetric healthcare costs as well, because a mom may end up not only having to sit out in that pregnancy, get off work a little earlier than usual, waiting to, make sure that she can manifest a healthy baby, but she's had to remove herself because her cervix started dilating or she's having contractions or any of those type of things. And when it happens, then you have lower birth weight babies. And I'm sure Candice will mention this. So, I mean, with that, harder times of regulating their body temperature, and then depending on what was the risk factor there. So from a maternal perspective, for sure, the African-American women were finding that they're higher risk of obesity, diabetes, hypertensive disorders. And it used to be like number one, no matter what, women would have higher death rates when it came. I'm not trying to be doom and gloom, not at all. Okay. Death, it's one of those things that we don't like. And honestly, as an OB, it doesn't happen as often because we really try to catch these things early. But one of the outcomes of moms with other maternal complications is low birth weight. And with that, it could be a baby that ends up staying in the NICU a little bit longer, or neurological or developmental delays. And, I can get on a soapbox all day about, okay, so that baby goes home and some of those resources are lost, or it's hard to get back those resources to take care of that baby who needs other needs, and because there are existing gaps in the healthcare system. So if we're able to consistently improve these outcomes, it means even more so the domino effect on the other side.
And then Brenda, if you could talk a little bit about some of the things that you would be looking for in a mom in preventing that low birth weight baby. So I know like exercise, how much weight you gain, those sorts of things.
Can you hear me?
Yeah.
So a couple of those things we, throughout their prenatal care journey, we look at things like weight gain. We look at fundal height measurement. So we're constantly monitoring the the effects of baby's growth, doing ultrasounds periodically throughout the pregnancy. So there's an ultrasound we do at 20 weeks. There's an ultrasound we do in the 3rd trimester. All those things give us an idea and a sneak peek at how this baby is doing. If there's any contraindications in the fetal measurements or the growth of the baby, then we look further into it. We talk a lot about nutrition and hydration and, the essential nutrients to grow a healthy baby. So all those things we kind of compact into the prenatal care journey, and, we use those as tools to help prevent things like preterm birth and low birth weight.
And Dr. Candice, what are the long-term effects of birthing a low birth weight baby? Like, what does their life look like after? Because there are a lot of implications.
Right. It really depends on what caused the low birth weight. So if it is a premature baby, especially our extreme premature babies, those children can have initial poor outcomes where they're in the NICU for very long periods of time. They can have retinopathy of prematurity. They can have ventricular brain bleeds. They can have respiratory distress syndrome, all types of issues and problems. And when they leave the NICU and on into their life, into the toddler period and early childhood period, they can continue to have some learning difficulties, problems with developmental delay. And that is so important that we track and follow premature babies well out into early childhood to make sure that we catch things early, not be in denial about it, catch it early, get the early intervention that they need. And these children can do well, and this could be well forgotten about miracle babies, because I have tons of them, right? But initially it is really, really tough. But you need people to have the foresight to tell you that most likely everything's going to be okay. Just do your part. The only other thing I would say is it's so important to try to prevent low birth weight and prematurity, because some things that we can't do anything about is they tend to have an increased risk for diabetes, obesity, high blood pressure, heart disease, long-term down the road. So that's a worry that I don't think we're yet able to do much about, except for just trying to prevent it on the front end. The other thing I would say, that if your baby is not premature, but just small due to other reasons, but then those babies can do just fine. You just might have a small baby because you and dad are small. Yeah. And so just having a low birth weight baby doesn't mean doom and gloom, because that baby could be healthy and fine. So it just really depends on the reason that we have the low birth status or prematurity, and then what we need to do from there.
So I want to make sure I'm clear, because I think sometimes this gets confused of like, what's the difference between prematurity, preterm, low birth weight?
Yeah.
They're not the same.
Right. So like Dr. LaReesa said, low birth weight is just weight. So you're less than 5 pounds, 8 ounces. And for a baby to be that size or smaller, there could be many reasons. You could have been born early, so you're going to be smaller, right? You came out the oven early, you're a smaller, baby. Or you could have, the second most common is growth retardation within the womb. So something's going on with mom more than likely, or there was some type of infection. So there's some infections that can cause that as well. And it really just robs that baby of the nutrients, or causes some type of insult, or even the placenta with mom. So many things that didn't get the proper nutrients to that baby, so they don't grow as well. And so those are the two most common reasons why babies are low birth weight.
Got it. All right. Do you have, before we move on to our Q&A portion, do you have any final thoughts that you want to add?
Well, one thing I wanted to say is to prevent low birth weight, prematurity, intrauterine growth, retardation, some of the things we need to do. And you guys have already said some of them, but some of the, like good nutrition, right? The soil, exercise, plenty of sleep. But I can't speak enough again into stress, managing our stress. I say WUSA, calming, healing practices, exercise, sleep, nutrition, meditation, yoga. You can exercise, you can meditate, you can do yoga when you're pregnant. Having good support system, like Dr. Ferdinand said, anyone who is toxic in your life, trying to remove those toxicities, whether it's substances or people, staying away from marijuana, tobacco, alcohol. Those things really can harm your baby, short-term and long-term. And so those domestic violence, that is toxic stress to a child. Domestic violence, we really need to work on that one. And so I think that's all I had, but those are some things that can lead to, and even racism, the stress and toxicity of racism is a weathering of Black bodies, Black moms' bodies that put us, that is even a factor. It's not race. It's not race. It's racism that puts our women sometimes in preterm labor. So we got to fight that too.
Would you recommend, I think I know your answer to this, but would you recommend therapy or some type of counselor?
Absolutely.
Part of that healthcare
team. If you're struggling in any way, it is nothing wrong with having someone to talk to. And I know you may say, oh, I talked to my mom, I talked to my pastor, I talked to my girlfriend. I'm talking about a professional who can hear what you say and hold you accountable to make a plan of action and have the skills to interpret what's going on with you and give it back to you in a way that's going to help you function in life.
Yes.
Sometimes we talking to our family members and things, they're just kind of a sounding board and just telling you their opinion. They don't have that professional expertise to really help us overcome these things like we should, that path to walk to get out of it.
Yes. Oh my gosh, you're preaching a sermon here. Every time I tell my mom I have an appointment with my therapist, she's like, you can just pay me. I'm like, nope.
You don't have the skills.
No.
And you love me, so you're not even gonna be real with me.
Right. Exactly.
I just wanted to add, I have a special passion for moms 35 and up because women are finding their partners later, especially African-American women. We have decided to delay or defer for whatever reason, whether it's partner, job, career, and the same thing for our white counterparts. But that special passion comes into, I'm saying this because the implications on a doctor's side and your insurance, they have already labeled you advanced maternal age or elderly. That is on a diagnostic code. So just FYI. All right. So I like to have real talk about this because it is so imperative that you, for women, to be more in tune with your body, because oftentimes you've gone through a lot of stress going into your pregnancy. There's a lot of hormonal fluctuations and imbalance. There's a field that's opening up a lot called epigenetics, which I love and what I work with women about, with optimizing hormones, before pregnancy, because I know this state is considered or lewd in a doctor's mind of, and just increasing your risk of having those other maternal complications that I mentioned, and also miscarriages or difficulty getting pregnant, or struggling with things that they may not, know. So that is part, that was what I wanted to add. And it also, this is important information for moms who are under 35 as well, but even more so because that dynamic is shifting a lot when it comes to our African-American females as well. They told me not to forget, I do have a freebie or checklist for moms, just things to consider on your next doctor's visit, you know, like the top 7 things that you might not even think about that I think is important. So that was just a couple of my little tidbits because I thought that needed to be out there about the 35 and up.
100%. I think, do they call it like geriatric? It's like geriatric.
No, it's not technically geriatric, but the diagnostic code is advanced
like it.
maternal age or elderly gravida.
All right, we're going to jump to some Q&A. So our first question that actually came in via text as people were registering was, what advice would you give to a mom that has an unsupportive provider, and how do you advocate for yourself? I'll just let any one of you take a stab at that.
I'll go. That is so challenging. When I oftentimes have had conversations with people, sometimes I'm like, what? They said that? You know, like, wow, you know, and what that does, that kind of puts you on the bench a little bit. It kind of closes you in. You're not quite sure how to. And so I will say this, depending on where you are in your pregnancy, it's okay. You still have a choice to choose your provider. You know, oftentimes if you're not too far along or that last month of your pregnancy, you might need to switch. I mean, this ultimately is a very beautiful time in your life. This should be a positive experience. And if you can't trust the person that is helping you guide your little one in life, then they're not the best fit for you. And that's okay. And so I would definitely consider changing providers or finding someone maybe in their office. You know, they may also have an affiliated nurse midwife, and you can say, hey, I only want to see the midwife. I don't want to see the actual medical provider as a doctor, or just ultimately switch. Excuse me, because what I think is something that we miss the boat a lot of times, we think that things start after baby's born, but there's a lot of science and research that supports your baby's in school. That's how you need to say that. In the womb, your baby is learning the environment. It is hearing your voice. It knows all the fluctuations of your hormones, probably more than you do, and they're reacting to it. So understand the womb is an environment that even something as a provider stressing you out because you don't feel comfortable, it's putting stress on your pregnancy.
Absolutely. You know, I wanted to bring up something that happened recently, and Dr. Ferdinand, you might can answer this. I would say pick up on that early and try to change early, because I had a mom to reach out to me via Instagram, a DM, and I'm a pediatrician, but she's 32 weeks. And something happened with that doctor, and it had been going on a while, and she wanted to switch, and now she can find no one to take her at 32 weeks. And now she's with a doctor who she doesn't like, her and her husband, and it's a strange situation. And I'm worried that that's setting her up for poor outcomes.
Absolutely. So that's a good question. I will say, depending on most practices out there, when you get into your 3rd trimester, they may not accept you, or you might have to work harder to find someone. Now, there are practices out there, as long as you have established prenatal care and you don't have risk factor, if they consider you, more of not a risky pregnancy, they will accept you. And then also insurance too, making sure that your insurance carrier is covered by any switch of your provider too, because a lot of times they may dictate where you want to go. So I think a really good question is to ask, are you delivering me, or do they have hospitalists at your hospital that you deliver at? Because that might be your way out per se. I hate to say that, as far as your plan of delivery. But if not, don't change who you are or your experience based on that. And make sure you surround yourself with a lot more people that are going to be there for you. And I'm sorry that you can't have a provider that you feel like you can trust, because that does, fracture part of that experience.
So another question that we have is, how do fibroids affect pregnancy/delivery? And this was a question from our audience tonight.
I remember getting that one, and I said I'll answer a lot because I figured that would be a good one for everybody to know. So one, look at when we talk about fibroids, it depends on location. You can definitely have a pregnancy, no complications, no problems with fibroids, but it really depends on location, size, whether you've had previous surgery for fibroids as well, and whether you have a menstrual history that dictates that you have some problematic fibroids. So if you, like I'm using an example, I have a patient who is 30 years old and she's had this fibroid diagnosed since 25. And so if she comes in, and I've always known that, okay, this is a small fibroid, it's located toward the outside of the uterus, I'm gonna already tell her that this is not a problematic fibroid for when she's ready to get pregnant, as opposed to someone else on a regular visit where they have a 10 or 12 centimeter fibroid, they have menstrual irregularities or increased pain, then, and they want to get pregnant and they've been trying, then this is someone I'm considering, okay, you need to strongly consider removing it before actually getting pregnant. And if you do, it can increase risk of miscarriage because of where it's located and its size, and it's already causing symptoms even before pregnancy. And then it also could increase risk of preterm birth, depending on where, if it's invading or encompassing too much of your womb. And if that's the case, then the baby, I mean, I've even had a C-section where I feel like this baby was just all the way to the side, the twin was the fibroid, because they can get massive. These things get really big. And pregnancy, 50% of them can grow, and then, some will just stay the same. So if you know you have fibroids, it's good to at least identify or follow them on a yearly basis and talk to your doctor specific. And I think it's really important to have specific questions. The change in medical care, oftentimes you might have a doctor's visit where you feel like you had questions, you forgot, you're rushing in, or they may not have had time. Jot them down, because those are specific questions that you can narrow down and know your risk or your potential outcomes.
So another question that we got from text as people were registering is, why are cesarean rates higher for Black women, and how can this be prevented? And I have a follow-up to that one too, but we'll start there.
Me again. I guess it's on me again.
Sorry.
That's okay. That's a really good question. The average or the national rate of C-section, if I'm quoting correctly, I think it's 32% or 35%. It depends on the institution. When we're talking about Black women and increasing C-section rate, it does have a good correlation with the reason why they're having the C-section. There are increased obesity and rates and BMI for our Black moms, and not saying that's all the reason, but that is one of the things, because increase in your BMI or your weight in pregnancy can distort the birth canal. It can have a risk of arresting your labor. And then hypertensive disorders, where if mom is so unstable where we can't get you to 10 centimeters and we got to get the baby out, and higher hypertensive disorders are more prevalent in our African-American mothers. And then diabetes, a big one as well. And if you have uncontrolled diabetes or coming into the pregnancy with diabetes, because in our African-American community, there are earlier diagnoses now, people that are getting diagnosed well before 50 or 40, and they have a higher risk of having bigger babies or having complications with delivering vaginally that may also prompt C-section.
So the follow-up to that is, we actually have two questions about this, slightly different ways of asking, but what's the risk in your perspective on a woman wanting a vaginal birth after a C-section?
That's a really, really good question. So the biggest thing with that, if you know for sure you want to have a vaginal birth after cesarean, you must find out, make sure you know why you had that C-section, because there's certain factors, whether like if your first baby was breech and you had to end up having a C-section, then that's a highly likelihood that you can find a provider that is willing to do a vaginal birth after C-section, as opposed to a scenario where you got to 10 centimeters and your C-section report says that you had a pelvic distortion and baby wasn't able to come out. Then if that's the case, then it may be a little bit more difficult to find someone to do so. The second component is not all hospitals allow it. So now you got to find a provider that is affiliated with the hospital that is open up to it. And a rule of thumb usually is a hospital that was considered a larger academic institution where residents are there, because one of the prime considerations of that, because of the risk of uterine rupture, which is still low, is that you need to have all staff there. And in smaller regional hospitals, you may not. And since it's considered an obstetric or, maternal baby emergency, you want to make sure you have your anesthesia there, your OB, all, staff and resources on hand to be able to handle that particular complication. And because of those main two components of why you had your C-section and whether you're affiliated with providers in the hospital that will allow it, or as part of their policy, is very important. It's very rare you're going to find somebody after 2 or 3 C-sections. I'm just going to put that out there. After 1, more likely, depending on that history.
And I have a question real quick. What about a home birth? So I get all of this stuff on my end. Had a mother with a daughter C-section and thought I found out just because I asked a whole lot of questions, thought she was going to have a home birth VBAC. Okay, Dr. LaReesa, tell us about that.
I'm biased because when you've seen stuff hit the fan, and I'm being polite, it's just you don't want it to happen where someone, because it's a matter of minutes that you have to act if that uterus ruptures. And so I'm going to always be biased. I really don't agree with home births with previous C-sections, but I've heard of people who do them. And it's out there. And, Brenda, please chime in with this as well, because you definitely have a better pulse on that. But I'm always going to be biased because I've seen stuff go bad. And it's like, oh, my God, I would have never wanted that to happen to someone who was trying to do it at home.
Well, we do, as licensed midwives, we do VBACs on moms. There are a couple of factors that we take into consideration. We look at things like having that initial consult to make sure that a trial of labor is advisable for that mom. We look at, again, the reason why she had the C-section. Was it a C-section, again, because her pelvis just didn't support the delivery of this baby, or was it because she had twins and then a C-section was necessary in order to deliver the twins, or if the baby was breech, or whatever that condition is? We also look at things like the C-section report. So what did the report say? How was this scar repaired? How was the incision site? We look at things like the scar tissue, the repair of that scar. How thick is that incision where the incision was in that scar? So we do, encourage things like that, measuring the scar, looking at the report, getting a consultation with an OB that says, yes, this woman is a good candidate for a trial of labor. And if all those things add up and the mom has had no complication throughout the pregnancy, then we proceed. We also proceed with the knowledge that, hey, as long as things remain healthy and normal, we're good to go. But if at any moment things are no longer healthy and normal, we transfer with no question. So, and we've had great success rate with women who have had successful home births after a C-section.
And that's where it comes to that informed decision. Because I also see someone had mentioned that, have seen successful, and that's great. I'm not saying that it can't, but I know I'm just going to be biased. I know I'm going to be biased when it comes to VBAC. I have nothing against home births at all, really, but it really is about making that informed decision, being coupled with the right midwife or doula that is there and knows when things are taking a turn and know to act fast. Yeah.
Right.
And then the last question that we have, and I think Dr. LaReesa, you've already answered it in the chat, but are OB practices now seeing postpartum patients at the 2 or 3 week mark?
Usually at the 2 and 6 week mark, it's pretty standard postpartum visits for vaginal and cesarean delivery. If I think the only thing that may change is if you had a C-section and if your doctor routinely sees those patients 1 week postpartum because of staple removal, or that's just part of their protocol. But most of the time, whether vaginal or C-section, depending on, no other issues, according to mom when she was discharged, it's pretty standard 2 and 6 weeks. But as I mentioned before, there's been a big proponent about really seeing about the needs of a mom postpartum. So we're supposed to, that's standard, but if we're doing postpartum screening scales or really tuning in and asking moms, or they're having difficulty breastfeeding and all of that, you want to make sure that you are collectively with someone that is willing to go beyond that, okay, you need to go see a lactation consultant, you need to do this, or, I was really concerned about how you were bonding with your baby. I need to see you back. I don't want to wait to 6 weeks. I want to see you back sooner than that. It's just a standard thing. And oftentimes, I hate to say, that has been elicited to what is technically according to what your insurance has placed, which is 2 postpartum visits. But it doesn't mean that you don't need additional care or attention.
Yeah. Any last thoughts before we wrap up tonight?
The only thing I would say also is just making sure, I don't know if it's come up, that you have also picked your pediatrician. You are well within your rights to do some interviewing or visiting pediatricians, to sit down and talk to them and talk about your vision for when you have your baby, and if they're in line with that, to fill them out. And definitely by the time you get to the hospital, you should know who that person is, you would like it to be. And so that your baby is seen within 48 to 70, 3 to 5 days after delivery. So if they're still in the hospital, that's fine. But 3 to 5 days of life, your baby needs to be seeing their pediatrician.
I actually just got one last question in, and it's really good, so I'm going to ask it, and then we're going to wrap up. After choosing a specific OB, how do you manage and make sure your birth plan is honored during delivery, as long as it's safe, if you end up with a different physician who is on call? I know that's a biggie.
That is such an excellent question. And I wish I had a straightforward answer, because you could be put in that situation where you have discussed certain things with your primary doctor, and then all of a sudden they're not available on the day you deliver, and you get somebody totally different, and you can present. And I will say, I can't speak for obstetricians or nurse midwives that are affiliated with the hospital, but we do try our best to honor birth plans, and it just, I just hope that it never falls on someone in someone's experience where they felt just really stressed and bombed out because it is a total derailment of what they had planned. But I'm sorry, I can't answer that, straightforward, because I've been there. I know that, just understanding that it's a comfort of knowing that this is what I plan and this is not what you end up with, not what you expected. So I pray that doesn't happen to you. But just understand that you may not get everything that you had planned if that does happen.
Yeah. Well, Dr. Candice, Brenda, and Dr. LaReesa, thank you so much for this conversation tonight. I know I've learned a lot. So thank you so much for being a part of tonight's discussion and being a part of our Strong, Beautiful Future family. I'd also like to thank all of the participants that joined us tonight. We had a ton of influencers and local people in the community join us tonight. I know you guys follow us and cheering us on and have great conversations all the time. So thank you so much for being with us.
Beautiful mommies.
Right?
Beautiful mommies.
They make it look so glamorous and easy.
I mean, like Beautiful Moms, and I'd seen something. I was like, we didn't even touch on really breastfeeding. I mean, I don't think we even touched on that at all. And that is something that I fully support. And I will say, I'm glad in the thread of Strong, Beautiful Future, and I know you're closing, but I just feel like this has to be brought up. I notice moms really, who are very good advocates for breastfeeding, but the truth of the matter is, statistically, most Black moms don't. And if you could tell your sister girlfriend or, keep advocating about your positive experiences and, like the nipple pain doesn't last forever, just get the latch right. I am, speaking as a mom who breastfed, and it's a beautiful experience, and you just got to be linked with the right person, and do not allow your hospital experience, because I've seen it happen, deter you from being able to breastfeed confidently and successfully with your baby. So I just, during this discussion that hadn't been done, I just realized I just saw mom. So we got to talk about it.
And
so I'm sorry. I know you're trying to wrap up.
No. I want to underscore that there's people that can support you. There's help available, and to keep trying if you can.
Yes.
So, as we end our program, I want to share just a little bit about our local partner, Healthy West Orange. They provide local resources, tips, and inspiration to help the community eat well, stay active, and enjoy life. You can learn more about the movement of their local resource center hub at healthywestorange.org. And to learn more about Strong, Beautiful Future, please visit our website, strongbeautifulfuture.com, for additional resources, videos from all of our amazing healthcare providers, and connect with us on social media. You can follow us on Facebook, Instagram, and YouTube at Strong Beautiful Future, and Strong Future WO on Twitter. And last but not least, please save the date to plan. Please save the date for our next conversation in March 2021. We definitely want to hear from you how you thought tonight's event went, what topics you would like covered. So we'll be sending out a follow-up survey via text message. Please complete that to let us know how we can make these events even better. So thank you all again so much for joining me this evening. I hope you all have a good night.
All right, thank you. Good night, mommies.